Hi everyone, this is Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a patient who attended with really itchy and irritable ears, and you may have noticed that they've been scratching the entrance of their ear canals, quite sore and red there. This patient has to attend every 9 months on the dot, and what we actually do is after each appointment we schedule them in advance for their 9 monthly appointment and just remind them a few days prior. I do ask this particular patient to instill some olive oil medical grade spray just the day before to soften the surface of the wax, and that's because historically the patient's earwax is really hard and dry and crusted, and the exterior surface of it's almost like sandpaper, and as we're removing the wax the patient finds it slightly uncomfortable because it grazes the side of the ear canal. And so the olive oil just helps to lubricate the canal wall and soften the surface so it's not as rough and sharp as we're bringing it forwards. I'm just using an ear hook here, and as the video continues you will notice, and I will highlight it to you, this patient has a bit of fungal spores growing and developing on the earwax itself. Fungus can actually feed on the earwax, and so they've got a strain of fungal infection called Aspergillus niger, which a characteristic of is fungal spores. They can either be black, yellow or white in appearance, and also these woolly strands, and that's, the latter is what the patient has got. Now, one of the other key landmarks of a fungal infection is extremely itchy ears. Now, even if you have a bacterial outer ear infection, so bacterial otitis externa, that can also lead to itchy ears. And indeed, in this particular case, the patient's earwax, because it's so dry and rough, that can also cause itchiness. But when you've got extremely itchy ears, it's more likely to be a fungal infection, because it's just one of the symptoms of having a fungal infection. With a fungal infection, the patient needs to use antifungal solution drops. They are available over the counter actually in the UK. We have notified their GP as well. Quite often, probably a bit too often, patients with fungal infections are prescribed antibiotics. I had a friend today who contacted me. I treated their daughter a couple of months ago, and I felt they had a fungal infection. I requested that their GP take an ear swab just to confirm that, to ensure it is a fungal infection and not bacterial, and therefore give the appropriate medication. That wasn't the case. They were prescribed antibiotics. The fungal infection actually got worse, because when you take antibiotics, it's going to not only kill harmful bacteria, but it can also kill some normal healthy bacteria that lives on the surface of the skin that lines the ear canal, on the skin flora. So on the surface of the ear canal, on the skin, it's got its own ecosystem. It's full of bacteria, and healthy bacteria and healthy strains of fungi. You can just see that there, the white woolly strands are feeding on the earwax, protruding outwards. And if you take antibiotics, you're going to kill some of those, which then gives the fungus free rein to colonize. It's got no competitors. And so this patient's fungal infection actually got significantly worse, and they developed a really swollen, inflamed ear canal, and they had to visit an ENT doctor to get some steroid cream applied into the ear canal. So it's very important when treating ear infections that we know what we're treating and we give the appropriate medication, because it can actually make matters worse. Because this patient has now got some fungi there, I've advised them not to use olive oil, because olive oil is a source of food for the fungus. So we just want to avoid that at the moment until this patient's fungus infection is completely eradicated. Generally, though, we just ask the patient to use it prior to attending, just the day before. So, but I've just made it clear not to put any oil in after the procedure, even if they find it a bit dry in there. So that's the patient's eardrum. So fortunately, this fungus just appears to be localized on the earwax, but there might be some spores that are microscopic, that's not visible to the naked eye. So we just still want the patient to receive the relevant treatment. explain to the patient to avoid water entering the ear. I can't stress that enough. This particular friend, their daughter, who went to see an ENT specialist today, the ENT specialist reinforced the fact, do not get water in the ear, because what the water does, it softens the skin, the outer layer skin, the epidermis, it macerates it, and it washes away all the natural oils that are like, it's almost like a veneer. You get these oils and sweats that coat and line the ear canal surface like a veneer, and that protects the inner layers of the skin. When you get water in there, not only do you wash away this protective film veneer of oil and sweat that lines the ear canal, but you soften and macerate the skin, and the skin then hydrates, it bursts its membranes, and you're then exposed to the middle layer of skin, the dermis, and that can get infected. Fungi can develop on it. So water is really, really bad. And bacteria and fungi both, they love warm, damp, dark conditions. So if you've got water in your ear, it just gives that that humidity, moisture within the ear canal. It just incubates the fungi and bacteria. After the ear infection has been fully treated by the ENT, the patient's going to come back. I'm talking about not this patient, I'm talking about the patient, so my friend's daughter. They're going to visit the clinic so I can make some custom swim moles. So whenever they go for a shower or for a bath or in the swimming pool, they can insert their swim moles to prevent their ears from getting infected. And so that's the patient's left ear. It's all treated, looks healthy enough. Now, their right ear, they've been scratching at this ear a lot more, and it's led to the entrance being quite swollen and inflamed. There's a lot of edema there. Edema is just fluid building up in the cells due to infection. So it's just another name for swelling. And they've got quite a sharp nail, and it's just cut into the skin here. And that's just unfortunately going to make matters worse, because, again, that outer layer of skin has been breached. That outer layer of skin is so important. It's a protective layer. It protects the inner dermis layer and the subcutaneous layer, which contains fatty tissue and connective tissue, at least on the outer third of the ear canal. So the inner 2/3 of the ear canal, the composition and makeup of skin is completely different. So skin typically has 3 layers. You've got the outer layer, the epidermis layer, which I've made reference to several times. Underneath that, you've got the dermis layer. And beneath that, you've got the subcutaneous layer, which is a layer of insulating fat and connective tissue. So that's what lines the outer third of the ear canal, the cartilaginous portion. The inner 2/3 is made up of bone, and it's only the outer layer of skin, the epidermis layer, that lines the bony part of the ear canal. And that's why the bony part of the ear canal is so sensitive. You've got to really tread with caution whenever we're removing wax deep within the inner 2/3 of the ear canal, or at least I am. I just don't want my patients to suffer any distress or trauma or pain when it's avoidable. So sometimes if there's a little bit of wax that I don't feel comfortable removing on the bony part, it's not significant, we just leave that, because I'd rather leave that than make it a painful experience for the patient. I've had trauma to my ear before as well. I mentioned in yesterday's video that growing up, my mum used to use cotton buds in my ear all the time, and I still vividly remember my left ear when she went a bit deep, and it was on the bony part. And that ear to this day is probably still a bit sensitive. When I examine my ear, or get colleagues to do that, there's no visible trauma, but that ear has always remained sensitive still. So if I get a gush of cold air into my ear, for example, that region just feels a bit sensitive. So when you've experienced it yourself, you're more able to empathize with the patient, and obviously you want to avoid them having a similar experience. See the patient's eardrum there fully, just this crusted wax at the entrance here. Just going to stretch the ear open, because, as I mentioned, this ear is a lot more narrower, it's a bit more swollen at the entrance. So I'm just hovering over the canal wall there, trying to avoid contact. If we're on the cartilage portion, the outer third, you can apply a bit of pressure. It's not as sensitive, it's more flexible than the bony part of the ear canal. And because the skin that lines the inner 2/3 of the ear canal is only the epidermis layer, it's extremely thin. It's less than 0.1 millimeters in thickness, Whereas the skin that lines the cartilaginous portion, the outer third, that's 1 millimeter in thickness, so 10 times thicker. So it provides like a buffer, an insulating pad almost above the cartilage to absorb, almost like a shock absorber. So hence why we can apply a bit more pressure on the cartilaginous portion, just to remove a bit of crusted skin on the roof of the ear canal. Eardrum looks extremely healthy, good light reflex there. Got a nice colour to the ear canal, it's nice and pink. Probably a tad, now that I'm looking at it a bit closer, just where the wax was, it's just compressed slightly, so it's a bit vascularis, but compared to in the past, the patient has had a bit of otitis externa as well, very dry ear canals, and it looks a lot healthier today. That's all the wax keratin that are removed from both ears. You can see different shades of brown there. You've got dark brown, which is more older wax and keratin, that's oxidized, and you've got the lighter shade, which is more freshly secreted wax and dead skin. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.